Yeah, it feeds into a man's innate drive to go out and to complete a quest, right?
Exactly.
Men were supposed to be knights. They're supposed to be the saviors, the protectors. You have that innate drive in you. And if there isn't something in your environment that's allowing you to healthfully exercise that, of course, the video games are going to be something that you would turn to because you still have that need and that desire. And that's a whole other topic too, right? It's just how people get sucked into these worlds that aren't real because they're trying to fulfill that need.
Hey guys, welcome back to another interview. Today we have an extremely special guest. I'm so happy to have her on. We have Dr. Sabrina Solt. Hey, Dr. Solt, how are you?
Hey, thank you so much for having me. I'm so excited to be here.
Yeah, I'm really happy to have you on. Do you want to sort of talk about what you do and what you do?
Yeah, I'll share with your audience a little bit about me. So, like you said, I'm Dr. Sabrina Solt. I'm actually trained as a naturopathic medical doctor. I'm currently located in Scottsdale, Arizona, and I do specialize in regenerative and anti-aging medicine. So, I do a lot of work with stem cell therapy, PRP, a lot of bioidentical hormones. We also do nutritional IVs, peptide therapy, and of course, I'm also a huge proponent of the carnivore diet. I myself have been a carnivore for about a year, and I do utilize this as a tool with a lot of my patients to help them get out of chronic pain and heal a lot of other chronic issues.
Awesome. That sounds so cool. Yeah, because usually I sort of get people on who are like doctors, they're more like general doctors, general practitioners, or people who are more into nutrition. But you're sort of going from a different angle, which is really cool. So do you want to sort of talk about maybe how nutrition you think plays a role into things like anti-aging, into the hormonal stuff and other things you were talking about?
Yeah, so it's such a great topic. And I think it's important for people to really hear this because everything that you eat, everything you put into your body sends a signal. And we can either send signals that continue to produce health, perpetuate positive growth, perpetuate healing and repair, or we can send signals that do the opposite, that cause damage, cause inflammation, and cause us to degenerate even faster. We look around us, we see the standard American, we see the average person in the world, and they're eating a lot of packaged foods, processed foods, fast food. And we see the implications of that that are really, really widespread as far as they're consuming a lot of pharmaceuticals. Many of them are overweight, if not severely obese. They're suffering from diseases like heart disease, diabetes, various types of cancers. And that's just the tip of the iceberg, right? Because those are the really extreme things. What we tend to miss out on are even just the subtle things, which is people that even just reach their 30s or 40s and they've got chronic pain or discomfort, or they've got joints that are degenerating faster than they should based on how old they are. And all of those can actually have roots in nutrition and the things that you do on a daily basis, which is why, doing something like the carnivore diet, we love because ultimately it's a very anti-inflammatory diet. It also works as sort of an elimination diet, but it also gives us all of the tools that we need to actually heal and repair within our own bodies.
Yeah, okay, cool. And do you think that it's more so the elimination of the processed foods and the refined grains, seed oils, and sugars that helps with the regenerative effect, or it's more the actual nutrition you're getting from the carnivore diet?
Yeah, it's actually two sides of the same coin, right? Because even if you were to say eat all of the right things in addition to all the processed stuff, it's going to be like bailing out a boat, right? So you're taking out some water, but some of it's still coming in. You really have to have both if you're going to want to heal. And this is why I kind of caution people sometimes, and they're like, oh, I'm going to experiment with carnivore. It's not just about increasing your protein intake or increasing healthy fat intake while still consuming the other stuff, because you honestly might make things worse doing that.
Okay, cool. So this is a sort of more controversial topic, or maybe not the first thing I'm going to ask you, but what's your thoughts on vegetables and plants, mainly vegetables for the, anti-aging stuff and for healing from stuff like chronic pain and inflammation in the body? Yeah.
Yeah. And so it's an interesting question. I used to be a huge proponent of vegetables before I turned carnivore, right? As a naturopathic doctor, you are always taught about the
Well,
benefits
yeah.
of vegetables and eating all that stuff. Now I won't touch them. And it has to do a lot with a couple things. One, of course, we know that there's high anti-nutrient levels in vegetables that most people who are inflamed and compromised to some degree simply can't handle, even if they've been eating them for years. The other side of that coin is the vegetables and everything that we have available to us now have been selectively bred over decades, if not longer, to be hyper palatable to humans and to be somewhat quote unquote safe to consume. we never would have been able to or wanted to eat these things in their natural wild state back in the day. And now we have them available to us, and people still continue to eat them. And then my question to them becomes, well, how do you actually feel when you're consuming these? And could you feel better? Oftentimes, if people are on the fence about giving up vegetables, I tell them to just do it for 30 days. They're not going to cause any quote unquote, dysfunction or
Yeah.
deficit in their nutrients in just 30 days, but they can make a massive change in the positive direction in those 30 days.
Yeah, I also say the same thing, like with carnivore or animal based, because I always try to go from the science perspective, or there's not too much nutritional science, but more like logic and just anthropology and stuff. And then people, if they're not convinced by that, I'll be like, okay, you can just try it for 30 days. And 9 times out of 10, because we know that this diet is our species appropriate diet, it will work. So, but yeah, that's a good approach. And what's the sort of thoughts on fruit now? Because I know that this one is more controversial. I know people like Paul Saladino go on fruit, or have fruit in their diets. Yeah.
Yeah, it's interesting. I personally don't eat fruit most days just because I don't feel like it. But if I do, the only fruit that I actually do eat is pineapple, and it's like maybe a couple times a month at this point. I give my kids fruit just because we keep it in the house. They ask for it. It's an easy snack when you have little kids, but they only ever eat it in isolation. I don't actually have them combine it with anything like protein or fat because of Randle cycle
Yeah.
activation, which we all know about that in this community. Which for people that don't know, it's basically the like really super short version of the Randle cycle is that when you consume carbs and fat at the same time, your body doesn't actually know what to do with the energy, so it's really not going to do much with it, and it's going to likely store it as fat. It's going to perpetuate some problems, all that good stuff. Now, fruit as a source of carbs for most people, I don't love because of the fact that most fruit is made up of fructose, which we know that overconsumption of that can actually lead to what we call non-alcoholic fatty liver
Yeah.
disease. So it's detrimental to the liver. And you have this the people that kind of argue for, oh, well, plants want us to eat their fruit because then they want us to go and poop it out, and the seeds are going to come out, and you're going to grow a new plant. I want to take that one step further. I think they're all, maybe they're right on this part, but the next step to that is, well, all that fructose in that fruit that's detrimental to your liver could push you into early death, which means now your decomposition for those plants to grow even more. So are the plants actually that friendly to us, or is everything within them a goal to just perpetuate their own growth and life cycles? So I'm not a fan of it for that regard. Now, there is the argument that, oh, some people need carbohydrates in their diets. And I don't know if anybody actually truly needs them, but I do believe that there are certain phenotypes that can use carbs strategically for their benefit. And it just is a really individual basis. And if that was the case, I would prefer them to get their carbs in the form of a glucose versus a fructose because of the liver damage.
Yeah. That's so interesting what you said, because I've done a bit of research on it, and they used to, like, with fatty liver disease, I believe it just used to be called fatty liver disease. And then
Mm-hmm.
when the patients stopped consuming alcohol, then they still got fatty liver disease, and they didn't really know why. And then they made two types: non-fatty liver disease and fatty liver disease, because I believe fructose breaks down into, I think, ethanol, or like the same product or byproduct as alcohol, which can cause the same damage as onto your liver. And a lot of people think fatty liver disease is also caused by fat, which just isn't true. Um, yeah, so that's really interesting. But do you think people like Paul Saladino could run into some trouble with the Randle cycle and that sort of stuff?
It's so hard to say. I mean, I've seen his videos where he dissects his own labs, and physically, he looks like he's in great shape. His labs physiologically seem to look like he's in relatively good health. Ultimately, only time will tell because there is something to be said for a person's own individual makeup. Ultimately, we are still humans, but all of us have a completely different set of DNA. So, how our genes combine to make our own unique expression as far as how we handle certain things, perhaps he is just one of those people that can handle them really well. And with the amount of physical activity he does, maybe he's actually just using them as fuel, right? I've seen some of his videos where he's surfing for like
Yeah.
hours a day, highly, highly demanding. And, maybe that for him, that's just the easiest way for him to get a fuel source.
Okay. And so you said that you've been in the carnivore diet for around 1 year now, and as a naturopath, you were promoting more vegetables and plant-based foods before. And I actually spoke to, I don't know if you see my video on it, but I spoke to a vegan at the Sydney vegan markets a few days ago. I made a video on it, and she was actually a naturopath. Um, and she, yeah, was promoting this vegan ideology, more plant-based. And so has it been difficult transitioning from telling your patients to, eat more plants to now a strict carnivore or more animal-based approach? What's that been looking like for you in your workspace?
Honestly, it's been easier. It's it's so
Really?
funny because people don't like they think that they like to eat vegetables, and I think it's like almost this, facade a little bit where there's almost like a virtue signal, like, oh, I eat so many vegetables, I'm such a good
Yeah.
person, I'm such a healthy person. But then when you tell them about this diet, they're like, oh my gosh, I can eat bacon, oh my gosh, I can have a steak every day, I can make burgers. Like, it's almost like a weight gets lifted because instinctually we all love and crave those things because they're supposed to
Mm.
be our proper nourishment. So I actually don't get a lot of pushback. And if I am with a patient where I think it might be a little bit of a touchy subject, I usually pre-phrase it with something like, "You're gonna think I'm crazy, but just bear with
Yeah,
me."
I said the same as well.
Yeah, you have to, right? And I sometimes I'll tell them my story, or I'll send them interviews that I've done so they can get a little bit more of a background. Sometimes I'll send them other people like Dr. Sean Baker, Dr. Anthony Chafee. So I'm like, here, it's not just me. Like, there's other doctors that
Yeah.
are talking about this too. And you'd look at the people in the carnivore community, everybody's in really great shape, really intelligent conversations. We are, we're very helpful. We're nice to each other. There's no like real animosity. Whereas you get people in some of these other plant-based or vegan communities, and like they can just be mean. So I think that once we get past just the crazy soundingness of it, pretty much everybody has been really on board, which has been really cool to see.
Yeah, cool. And on to the next topic. So, do you want to sort of talk about the erectile dysfunction sort of area and how nutrition or what tips you sort of have in that area? Because I know it is an issue that a lot of specifically young men deal with nowadays.
Yeah. So what's been crazy to me is that, when I started working with men in my practice with erectile dysfunction, most of them were much older. Like, we're talking 50, 60, 70 years old. And, they would start getting declining testosterone. And that's why they would get the erectile dysfunction difficulties, right? But that's just one part of it. So you need three ingredients for an adequate erection. You need adequate hormone levels, which is testosterone. You need adequate blood flow, and then you need adequate nerve conduction. What I'm seeing now is more younger guys experiencing this as a difficulty because of the two other reasons. Now, low testosterone can be a problem, but it's very rare for a young guy to have really, really low testosterone unless they've just kind of completely shit on their health for their entire lives, right?
Yeah.
But the other two things, the blood flow stuff, that's going to be impacted by diet, specifically high sugar and high processed food diets. And then the nerve conduction issue, that's going to be impacted by watching too much porn as a really big thing for a lot of guys. So, young guys, they might, think it's really cool, get into watching this stuff online. It's free, it's available, it's fun. But ultimately, that overall desensitizes them over months, over years, to the point where it becomes way more difficult for them to achieve an erection in a real life situation because they don't have that heightened stimulation on their nervous system from watching something like porn.
Yeah, so all this stuff like pornography and stimulating stuff for young teens, why do you think that it's sort of pushed heavily onto us and it seemed to be okay? Do you think that there's some, malicious intent from the upper authorities to try and make men in particular and society, young people in society weak as a whole, maybe so, we can't reproduce or be as strong or
Yeah, I think you kind of hit the nail on the head. We can like put on our tinfoil hats and stuff to have part of the discussion, but I really do think that there is a general attack on masculinity. Not, the porn is just one facet of it, and absolutely, it's become so pervasive. A lot of people are watching it, and it's damaging not just the man and his health, but it's damaging relationships, it's damaging families, and it's because it becomes an addiction, right? The man is seeking something from that porn interaction that he's not necessarily getting in another part of his life, or some fulfillment that he's missing. And I think ultimately the way that we would get stronger men, healthier men, more masculine men is if we really did try to push that connection that guys are looking for, that they wouldn't be getting from the porn, right? We all need community, we all need connection with each other. And right now, when everybody is so behind their screens, they're not actually going out and connecting with people, or a lot of people are in this world where it's like the fast hookup culture, right? Seems to be disposable. You can swipe left, swipe right, and always seems to be just like the new and the better. It really doesn't leave room for people to go with the old fashioned stuff, which is the start the family, have that one connection with one person, because that's what really actually perpetuates strong societies, right? Is that strong nuclear family structure. So personally, I'm a really big proponent of promoting just general healthy masculinity, promoting, saving, not, you don't necessarily save sex for marriage unless that's like a religious concern of yours, but at least saving sex for one person that you're going to be committed to for a very long period of time, and really just bringing back that sacredness between the masculine and the feminine, those relationship dynamics.
Yeah, I think those traditional values are so important. And I think that as society sort of more sways away from those traditional values, we start to run into a lot of problems. Um, Things like the feminist movement, which, I'm all for empowering women. I want women to be so happy and stuff. But I feel like the feminist movement is just not doing good for women whatsoever. I feel like it's telling men to be more like women and women to be more like men. And, in a relationship, if you're not like different, like, opposites attract, you need to complement each other, it's just not really going to work out too well. So I think returning back to those traditional values is so key. And even on, not even with pornography, even on the point of like, even just video games, I was a video game addict, as most young kids are, a while ago. And it's just sort of, it's like, it's like a lot of the games, they're just replacing a reality of the world. So for example, say if my real life sucks, right? I can just go in a video game and level up on there and sort of recreate that that
Yeah.
character for myself and just level up my
It
own
feeds
character. Yeah,
Yeah, it feeds into a man's innate drive to go out and to complete a quest, right?
exactly.
Men were supposed to be knights. They're supposed to be the saviors, the protectors. You have that innate drive in you. And if there isn't something in your environment that's allowing you to healthfully exercise that, of course, the video games are going to be something that you would turn to because you still have that need and that desire. And that's a whole other topic too, right? It's just how people get sucked into these worlds that aren't real because they're trying to fulfill that need.
100%, 100%. Yeah, because I'm a very ambitious kid. And then the times when I turned to video game was when I had an injury or I had like a lot of chronic pain. I wanted to like, really dominate my sport or dominate the gym. And I just felt helpless. And I sort of turned to video games to try and level up in that and to, conquer in that. But it's like, it's just a false sense of reality. And I think that it's very dangerous for young men. And I think also, a lot of people say to me, oh, no, video games aren't that bad. I can just play like 1 hour a day, but I just think it's toxic because like for me, now that I've stopped playing it, it feels like everything in my real life, it's like my life has sort of become the video game, as cringe as that sounds, because it's like now I don't have this stimulating thing that I can just run away to. Now I actually want to level up in real life. And although it's slower and harder and it takes more time, it's more fulfilling and there's actually real connections rather than just through a screen.
Yeah.
Um,
That's a powerful realization to come to, honestly. And, I think it's cool that we actually were able to go there in this conversation, especially if your audience is, kind of in your age range and everything. And hearing somebody else say it is sometimes just enough for them to realize that, oh, yeah, maybe this is a change that I should be making too.
Yeah, so I've heard people like Joe Rogan talk about stem cell therapy, and it seems like a new treatment, a new really effective treatment. What's your thoughts on stem cell therapy, and do you think it's got a bright future? And for people who don't know what stem cell therapy is, do you mind just quickly explaining it?
Yeah, we can totally dive into that. So obviously, I think it's wonderful. I've been doing it for almost 10 years. I did my first regenerative injection back in 2013. So
Well,
it's been just a continual progression for me. And I've been practicing actual stem cells, which when I say actual stem cells, I mean when I take stem cells from your own body and then give them back to you. I've been doing that since about 5 years, 5 or 6 years now. So since then, I've seen the field grow because there isn't a lot of us doing it, right? Especially in the United States. Like I go to the same conferences every year, see the same faces. And what's been really cool is just being able to develop these relationships with other doctors where we share all of our progresses. So over the years, I've treated a ton of different things. I treat a lot of musculoskeletal disorders, so chronic injuries, chronic pain, shoulders, hips, knees, low backs, necks, whatever it is, we can usually treat with stem cells. And what's been
well,
really cool with that is that we get people better. We get them off of pain medications. We prevent them from having surgery, especially if they don't necessarily need it right away. And what I think is going to happen in the future is that it's going to be more widely accepted. Right now, it's still like a very niche thing. And a lot of times people don't even see it as an option. But what I want to happen in the future is that, so say somebody tears a rotator cuff, for example, that their first thought is, how can I regenerate this versus, oh, I need to get pain meds and I need to have surgery. I think that's the shift, right? Is getting people to actually think about, okay, can we heal the body first before artificially meddling with it?
Yeah, cool. So, because I've had actually labral tears on both of my shoulders, and the doctors or the surgeon said that, a labrum can't just heal by itself. It's probably just going to keep getting worse. It'll slowly tear more. Without surgery, it can't heal. So, is stem cell therapy a sort of intervention that allows your body to actually repair that tear or that tendon?
Yeah, it definitely can. So, of course, every case is different. And without knowing the actual details of your case, can't say for sure whether it would have
Yeah,
helped
yeah,
worse,
yeah.
because sometimes there can be tears called slap tears.
Yeah, that's
And
what I
those ones
had. Slap. It's
those
like,
definitely have to be a surgical repair, unfortunately. And
yeah.
sometimes people can just have regular old tears. Putting stem cells in there can definitely heal them because they can actually signal to the chondrocytes within that cartilage to regenerate and repair.
Well,
And of course, we usually have to do things like some physical therapy alongside it and possibly have it braced and whatnot. And it may take more than one treatment, but sometimes that's better for most people than having to get a surgery.
yeah, because I know surgery can be quite invasive and it can take a long time to recover. Like my shoulder surgery took up almost a year to recover, or even longer. So how does it sort of compare with stem cell therapy? A more is it a quicker recovery? Is it less painful? Yeah.
Yeah, so stem cell therapy definitely less invasive. We have the benefit where, we're generally doing an injection into the area to deliver the stem cells. We're not actually going in there and kind of rearranging your anatomy, so to speak, right? We're not cutting any cartilage off, stitching any tendons or anything like that, which usually makes the recovery a lot easier. Now, then the other question becomes, well, how long until they work? So stem cells usually take about six to 12 weeks to fully work for somebody, for them to start seeing results. Some patients can take as long as 6 months. And then, of course, the stem cells can actually regenerate for anywhere from 6 months to a year. And we know that from studies and being able to detect them at those sites for that long. On average, most people feel a difference within the first 30 days.
Wow. So have you seen what's like the most craziest sort of recovery you've seen from stem cell therapy?
I've personally had multiple patients get out of wheelchairs. Not anybody
Wow.
who's been like a quadriplegic or anything like that, but patients who have been otherwise wheelchair bound because of severe pain, severe injuries, especially low back stuff, hip stuff, knee stuff. We've been able to get them a significant amount of function back.
Well, because I know I know a little bit about chronic pain. I know that it's got a lot to do with your nervous system, um, and your physical as well, like desensitization and stuff for your physical. So would stem cell be really helping address the physical side, or does it touch on the mental side much at all?
Such a good question. There's totally a mental component to healing. And this is something that I realized many years ago with my patients is that if they were in a mindset that said, I'm not going to heal, I'm always going to be in pain, this is never going to work, well, that's what's going to become created in your reality, right? So now, whenever patients decide to work with me, I actually have a whole online program that I put them through. And the first module in that is actually working on their mindset. So I actually teach them how to completely rewrite their beliefs, rewrite their subconscious so they can get into a mindset that's conducive to healing. So we kind of take that variable off the table.
Well, that's so important because I feel like if you just address the physical side, the results will only be so limited. Because I know, like, the placebo effect, and not even placebo, just the power of belief is so important. And personally, with me, I've had a lot of limiting beliefs with my pain. I always thought, oh, I'm never going to be successful, never going to do this, blah, 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 because can't sit still for this amount of time, can't do this. And it's just so important to rewrite those scripts in your head that have been written for you by either whether you don't have pain, whether it's by society, whether it's by your own brain or, your beliefs. Um, yeah. So do you think that do you get a lot of your patients that heal from stem cell therapy on a more animal based approach, or you don't really go into it with that too much?
Oh no, we definitely go into it.
Oh,
That's
okay.
yeah. So basically, what the kind of flow of what happens is somebody, they get interested in working with me. We do an initial consultation. They decide if they want to move forward. when they decide they want to move forward, that's when they enroll into the online learning platform. And I actually do have a whole diet module in there that walks
Wow.
them through animal based. And they do all of this before they even have their first like in detail meeting with me. So we've kind of got our bases covered. This allows me to be a lot more strategic in our first meeting because we spend an hour together. And that allows me to dive into stuff that I don't have to reteach the basics, right? I don't have to teach them animal based. I don't have to teach them how to sleep. I don't have to teach them mindset stuff because they already did all that work. So now it's about refining that. So we get to get super, super precise, and we get to dial in animal based or carnivore even more for them so they can get the better results.
So do you think that animal-based or carnivore is like the most optimal diet for healing? You think
it,
it's
that's that's what I've seen because I've done the other stuff, right? I've had people do tons of vegetables. I've had people do, all the other variations of this.
yeah.
And so far, it's super sustainable for most people long term, and it gives them the most ingredients or substrates for their body to actually heal with, right? Like
Mm,
we're made of muscle meat and saturated fat. So if those are the things that you're trying to heal, it would make sense that you would eat them. And once I make that connection with her patients, they're usually like, well, of course, that makes complete sense. Of course, like not one part of them is made of cellulose. So there's no point in eating the vegetables.
exactly. And when I started the carnivore diet, I had this tendonitis in my hamstring that hadn't gone for like a year. And then literally within 2 weeks, it like went so much and I was able to walk. And my doctors thought it was a miracle. And just so much inflammation in my shoulders, my lower scapula, it's just fully just calmed down. Do you think that that also could be due to the like, do you know much about autophagy and stuff? And also do you think that water fasting, have you experimented with water fasting with your patients as well?
I don't have a lot of my patients do water fasting for a couple of reasons. One, when we're doing stem cells, I usually have them just do a variation of intermittent fasting because I do
Yep.
want them to enter autophagy to a degree. And I do want them to, have some of that senescent cell die off, but I still want nutrition coming in because
Yep.
most of them are coming to me severely undernourished because most of them have been eating plants, they've been eating a standard American diet. And when we're about to put their body through such a like a high nutrient demand time. Like
Mm,
when you're healing from stem cells, it is high nutrient demand because they are literally rebuilding. And so this is another shift that I usually have to make for people is that now you have to eat super intentionally and you actually have to eat more than you think you would because we're trying to pack in that nutrition. So I have them do intermittent fasting beforehand, but still eating a good amount in their eating window. But then after the procedure, intermittent fasting goes out the window. I need you packing in the food so your body has something to work with because we put a lot of demand on it.
okay, cool. Yeah, I know how like powerful autophagy can be. Also, as you said, you do intermittent fasting, just like letting your body, heal and um recycle those like dead cells in your body. And yeah, it's so powerful. I think that science also is still learning about autophagy and we don't fully understand it yet. Um yeah, and I
It's
know that
great though.
yeah.
Mm.
And I know that chronic pain can be one of the worst, if not worse, like conditions someone could have. I think I'm not sure the statistics, but I think it has like the highest. Does it have the highest suicide rate for like conditions or something, or no?
It can. So there's certain conditions that have super high suicide rates. One of them is actually a condition called arachnoiditis. I'm not sure if you're familiar with that term, but this is actually a subset of patient population that I've been serving for many years because there's not a lot of options for them. For those who don't know, arachnoiditis is a very severe inflammatory disease process around what's called the arachnoid layer of the spinal cord, and it also usually involves an adhesive component to it where the nerves that exit from the spine will actually start to clump and adhere together inside this kind of buildup of scar tissue that's
Well,
occurring. Usually happens after surgery or some sort of epidural or lumbar puncture that just went wrong. Sometimes it's a result of trauma, but it's usually something at the hands of a provider, which sucks. But ultimately, these patients end up in the most severe chronic pain that I've ever encountered personally in my clinical practice. They oftentimes lose their ability to walk, they lose their ability to urinate, to defecate, to have sexual
well,
function. A lot of neuropathic pain, so burning, tingling, just like nerves firing uncontrollably. That disease process, unfortunately, has a very high suicide rate because there's almost no options. Medications usually don't work on it. Pain pumps do almost nothing for it. Thankfully, we've been able to utilize stem cells for these patients to really help them get
well,
back
that's
a
amazing.
decent quality of life. Yeah.
Wow, that's amazing. Because as someone who's suffered from chronic pain, I just know how detrimental it can be to one's mental health, because it's like a chronic, it's not just a chronic pain, it's a chronic cycle of depression. You have a lack of focus because the pain is the only thing that occupies your mind, and you just feel so unable and weak, and it can just be so terrible. So I really think I'm really commend you for this, doing this stem cell therapy and stuff and giving people with chronic pain and injuries a chance, because most people would have encountered an injury, but suffering a long-term injury is just so bad for you mentally. Um, would you give, maybe would you want to give like 3 tips or a few tips of advice to someone who has even not just chronic pain, maybe an injury right now, what they should do, or a more
Yeah.
mental approach?
Yeah, I mean, gosh, the most important thing you can do if you're suffering from literally any disease is just start to fuel your body appropriately, because your body's only going to work with what you give it. So if you're constantly giving it alcohol, sugar, highly processed foods, grains, things that are not going to be conducive to you actually healing, you're never going to actually heal, even if you were to pursue something more advanced like stem cells. Like you really have to dial those basics in strongly. And
Hmm.
then, of course, sleep. Like sleep is something that pretty much all of us do
Yeah,
every
yeah.
single day, but sleep is actually a skill set that you can cultivate over time. So you can learn your basic sleep hygiene stuff, right? So avoiding the blue light and the screens before bed, sleeping in an all dark room, making sure your temperature is nice and cool. And then, of course, going to bed at appropriate times so that you can get both your deep and your REM cycles in addition to the light sleep. Like dialing in sleep, people don't understand how much this can actually move the needle on your chronic pain, because
Mm,
actually they've done studies on sleep deprivation where sleep deprivation does increase your perception of chronic pain. And I know for some people this is like a cycle that perpetuates, like they have so much chronic pain that they can't sleep and they can't sleep because they're
yeah,
in
yeah.
pain. And so sometimes you have to just like take the bulls by the horn and do whatever you can to get yourself comfortable. I've had some patients that have had to get really creative with their sleeping positions, really creative with their pillows and how they get propped up so they can just get somewhere that works for them. I've had people that have had to get like really custom beds, but man, we spend a third of our lives sleeping roughly. It is something that shouldn't be overlooked and should be completely dialed in because that's when your body is going to heal. You can give it all the tools, you can do everything else, but your body's only going to heal when you sleep. So you have to be doing that. And then third, I would say just drink some water. Dehydrated tissues are painful tissues. Making sure you're staying hydrated is going to be super helpful with that as well. And it's sometimes like people don't even pay attention to that, and it can move the needle.
Yeah. And I feel like no one really, everyone knows, eat healthy, sleep, and drink water, but no one, for starters, even knows what eating healthy means or really what sleeping healthily means. Um, and no one even knows how important these are. And me just understanding how important each one of these aspects is, I think I've dialed down the nutrition one pretty well so far. Um, and now I'm trying to optimize the sleep. I've been reading a book called Why We Sleep, and I got a pair
Yeah,
of,
Matthew Walker's book. Yep, I have that book. Mhm.
I've been trying to get up at just before sunrise or at sunrise for the circadian rhythm, and I got this like pair of blue light blockers. Um, Hopefully try to optimize that, and I find that I feel like everyone knows, oh yeah, eat healthy and sleep right, but until you actually are eating really healthy, like a animal-based diet and sleeping really well, and then you return back to normal, you don't actually realize how much worse you will feel. Because I notice when I get bad sleep, my pain goes so much worse. It's unbelievable. And when I eat crap, my pain goes so much worse. And not just pain, just everything. Um,
Yeah,
yeah,
that immediate feedback is so important for most people. And the truth is that you have to be doing the good habits for a long enough time that your body can get to a new base set point,
yeah,
right?
yeah,
And I kind of describe it like a continuum, right? Like if this is the bad end of the continuum, like just you're feeling your absolute worst and you're constantly over here, well, having moments that knock you down, you're not getting knocked down as far. But if you're constantly getting better and better, and then you do something to knock you down, well, the fall from here to here
yeah.
is
Mm,
significantly more. You feel it way more. And this is, I think, what you're probably talking about, right? Like you've got
mm.
further fall to that really bad state.
Yeah, because whenever I sort of push this carnivore diet forward, people are like, oh, I feel great, I feel fine when they're just eating junk food all the time. And then I'm like, yeah, but you don't actually know how good you can feel. Like emotions are relative. At the end of the day, emotions are relative. It's a comparison. So people think they're feeling fine, but then when you actually eat proper food and you feel this amazing jump, you're like, wow, I never knew I could have felt this good. Is that something that you experienced as well when you started carnivore?
Yes, 100%. I mean, I used to eat a salad for lunch every single day, and I would like spend my afternoons like tired, my like upper back would hurt, and I would be like stretching all the time. That's gone. Like my chronic pain, like you, it's gone almost down to nothing. And most of it was from diet and stuff like that. I definitely have better mental clarity. I have more energy in the evenings, which I used to come home from work and just be like a vegetable. Like I would not want to do anything. I would not want to move. I would just want to sit on the couch and just like wait for bed. So yeah, better energy, better mental clarity, just effortlessly fit. And that's something that like, is really hard to explain to people, but it's easier to put on muscle. It's easier to get strong. You never get bloated. You like everything is just, it just works so well. And I just never have to question if my body is going to be in a state that can keep up with my day. And that
Mm,
used to be a concern.
mm. And people always think that, as you get older, when you're 60, 70, 80, you just get like aches and you get injuries and you can't be fit. But that's just not true. I feel like it's just another lie that we've been fed that,
It is.
like you
It
just get.
is. Yeah. It's crazy because I mean, being in like aging world that I'm in, I go to these specific anti-aging conferences, and what they've been teaching for years now is that you have to treat aging like a disease, right? So you have to treat it as something that's not physiologically quote unquote normal, and you need to be actually getting to the root causes of it, which is highly inflamed bodies, poor nutrition choices, bad sleep. So, this is the things that we do in the clinic. Like we treat those root causes of aging, we correct them, and we get people healthier so they live longer and they live better during those years.
Yeah. Well, it's so awesome to just see because I've spoken to other people who are starting to implement carnivore, more animal-based approaches into their clinics. I actually forgot to ask, but how did you even find the carnivore diet, or why did you even start it in the first place?
Yeah, my husband actually did it. It's crazy. He likes to investigate stuff on YouTube, and he was going through some of his own health challenges at that time. And he came across Dr. Anthony Chafee, and Dr. Anthony Chafee, as we know, he's the most extreme as far as meat, salt, water goes. And my
Yeah.
husband's very hardcore and extreme as well. So he's like, I'm just going to cold turkey and do meat, salt, water. And I was like, you're going to die. Like I thought that he was completely insane. And then like a month or two goes by, and he's doing amazing. His skin's clearer, his mood's more even, the whites of his eyes are whiter. I remember looking at him one day and I'm like, they're glowing white. Like, how is that even possible? And just everything was better for him. So that's when I was like, all right, I need to try this for myself. And I gave myself 30 days, and I gave myself like increments of 30 days. And I slowly took things out of my diet. It took me probably a good 6 months before I was full carnivore.
Yeah.
And I don't think I'm going to go back. It's been the best thing I've ever done.
Wow. Yeah, I feel like also once you give it that try, once you also enter that rabbit hole, you start going to Instagram, seeing people like Chafee, seeing people like you and myself, and because at first people think it's this weird sort of fad, and then you actually understand, hang on a sec, there's so many other people doing this, and it's a community, and people are healing. Have you been promoting a carnivore lifestyle? So you've been promoting it for like the last year on your Instagram, I assume. Yeah.
Yes.
And
Mm-hmm.
have you been getting a lot of, hate or feedback in particular because you're like a naturopath and stuff? Because I imagine a lot of naturopaths would be vegan. They'd be saying nourish your body with, healthy green veggies, get all your
Yeah.
phytonutrients and
It's so interesting. So, what I've learned in this is that the people who are confident in their food choices don't say anything to me because they just don't care. Like they're cool with what they're eating. It's the people who are questioning whether or not they're correct in their choice that feel the need to attack me because they need validation. So, in my circles, like I have one friend and she's lovely. She's another ND, but she's like so hardcore vegan. So we joke that when we're at events together, like we make up full meals between the two of us because I eat all the meat and she eats all the vegetables, right? So it's kind of like funny, and we get to maintain our friendship, and we follow each other on social media, and there's like no animosity there. It's cool. But yeah, there are some people that just try to like could be combative. And here's the thing, I have no desire to try to sway somebody one way or another. I'm leading by example because this is what's worked for me. I'm showing you the points that you might not be considering. And I'm just urging you to give it a try if what you're doing right now is not getting you the results that you're looking for. Right. If you're completely happy, completely healthy, great, keep doing what you're doing. And then I also joke, I'm like, I'll take another provider and we'll go lab to lab, physique to physique, strength in the gym against strength in the gym. We can go MRI to MRI, CAC to CAC. Like, let's just have a friendly comparison with objective markers, and we'll see whose diet is actually supporting that the best. Had no takers so far.
Oh, you haven't done it yet?
No, nobody wants to challenge me. It's cool though. Like nobody wants to compare our labs or compare physiques or compare strength in the gym. It's cool.
Because they know they'll get smoked,
Could be.
probably.
But then again, if their diet was working, these metrics should be okay, right? Like all should be healthy because that's what a diet is supposed to do. It's supposed to nourish us towards health.
Mm. Your career path sounds amazing. Amazing. Do you have any more plans for the future or things you want to do in the future?
I'm trying to educate more people online right now because I feel like, it's really limited when you're a provider and you have a lot, big message and want to help a lot of people to only see people in your physical location one-on-one. So I'm just trying to grow on social media a little bit more, spread more information, run more programs for people, do more educational stuff so that we can heal on a wider scale.
Do you think that the sort of carnivore movement or more ancestral approach to movement, not just eating meat, but also going away from technology and porn and all these other things that they all come hand in hand, returning to a more ancestral state. Do you think that it will get better, or do you think that society is just going to keep getting worse? If you're going to be
Gosh,
honest.
it seems like there's a divergence, right? Because while there's groups of us that are going this way, there's there's a whole other side to it too, with like AI and how that's going crazy right now too. I mean,
The
there's going to be a point,
metaverse.
yeah, where these machines know us better than we know ourselves and can predict our behavior better than we can. But ultimately, they'll still never replace a human. They'll still never have the empathy, the compassion, the understanding. Like they still will never pick up on like the nuances that make us real. And I think there will be a divergence between those of us who get it and realize that like true living is living. And then there's still going to be people that are going to want that false life, false sense of security, false sense of relationship, false sense of connection. And there just might be a big divide.
Right. So you think it's going to be a bit less gray area in the middle, there more just be people splitting and just there'll be a more open, yeah.
Yeah, I think that AI could be useful. I think that there is going to be, if you can get a robot to perform certain surgeries that's going to have a 99.999% accuracy, never get tired, never shake, never have like a
Mm.
hangover or whatever else, or like, a surgeon has just been eating plants their whole lives, then yeah, that's probably going to be the better option if you need like your appendix removed or something like that, right?
Yeah,
But think the connection, the real humanness, the actual relationships, like that's what humans
sure.
crave. It's the absence of those that leads to things like depression, addiction, anxiety. I think that we need to continue to build those as much as we can so that we can keep people healthier and not going into the fake relationships and everything like that.
That's a great point because feel like technology is doing a lot of positive things, but I think a lot with society, the more progress we're doing, we're actually making less progress because we're trying, even with the medical system, okay, we have an issue now, so let's try and think of a solution. Well, why don't we just go back to what we used to do before we had that issue? Because yeah, and that's a great point you made. But yeah, thanks so much for coming on. That was an amazing discussion. So where can all our viewers find you and reach out to you?
Thank you so much for having me. This was fun. My main website is stemcelltherapypro.com. I'm most active on Instagram. You can find me there. It's just at Dr. Solt, DRSOLT. And then my husband and I, we actually have a free carnivore focused Facebook group. You can find us on there if you need help and support in your journey. And we're carnivore, harder, happier, healthier on there. You can just look us up.
All right, I'll put all the links below, and guys, make sure go shoot her a message on Instagram, check out all their websites, like all their videos and stuff. Yeah, thanks so much for coming on today, Dr. Sabrina Solt. It was a pleasure to have you.
Thanks again.